Half a day. Welcome everyone to the Guam Congress building. Today's July 25th, Thursday, 2024, and the time is 2:02 p.m. In compliance with the Open Government Law, notice for this public hearing was published in the Guam Daily Post and posted to the Government of Guam Public Notice Portal on Wednesday, July 17 and Tuesday, July 23rd, 2024. Notice was also sent to all senators and all main media broadcasting outlets by email, and this hearing is being live streamed on the Guam Legislature's YouTube channel. So the rule I would ask for all of you to follow is if, just not to cause any distraction for those testifying, but for those who are testifying, to please begin by stating your name for the record. Their hearing today will be transcribed. We have one agenda item this afternoon, that is the appointment of Carissa Elaine Pangelinan to serve as the Director of Guam Behavioral Health and Wellness Center at the pleasure of the Governor. I'd like to thank and introduce my colleagues who are present with me today. My Vice Chair of the Committee on Health is Senator Joanne Brown. Senator Terlaje is also here, and Senator Roy Kanata. Thank you, Senators, for being here. All right, so the Guam Behavioral Health and Wellness Center is charged with many things according to our law. They have the powers to, it says the department adhering to federal regulations has power over local physical needs, feasibility, and appropriateness, shall provide mental health, alcohol, and drug abuse treatment services, establish regulations concerning fees for services which may be based on ability to pay, establish a 24-hour crisis intervention services to include, as needed, a mobile crisis team and a hotline, partial hospitalization and aftercare services to include transitional homes for the mentally ill, outpatient services to include, as needed, team services for children, the elderly, and adults, individual, group, and family counseling services, inpatient services including acute psychiatric and alcohol and drug detoxification services. Inpatient services may be contracted with any qualified provider. They shall provide mental health, alcohol, and drug abuse prevention programs and services, which shall include, I'm not going to read this list, but things for the youth to promote alternatives to drug and alcohol use and education. There's a treatment center within the department whose head will be a classified employee who will report directly to the Office of the Director. Of course, they manage federal grants. A lot of our funding comes from there, and they are also responsible for, adopting rules and regs to manage all of these programs. The department and the Guam Health Planning and Development Agency shall work jointly to adopt the standards and procedures for licensure of mental health regulations and other needs. They are in charge of the Guam Mental Health 5-year state plan and updates to that, another federal mandate. The Guam 3-year plan and annual amendments to that, which constitutes the mental health component of the Guam Health Plan, and they have, in fact, established many programs. I'm sure we'll hear testimony about them, but these include, in addition to the programs we talked about, the drug and alcohol treatment and the counseling and the day treatment, also the Healing Hearts Rape Crisis Center, crisis hotline, intake and emergency services pharmacy that they are running up there now. They are in charge of prevention and training for youth and tobacco cessation, other things. And of course, in all of this, they have clinical support services and child adolescent services and nursing services and psychiatric services and residential recovery services. And the list goes on and on. Okay, so just to make a point of, yeah, this is a huge responsibility for this candidate. So we're very happy today to welcome Carissa Pangelinan and all her family and supporters who are here. And we will begin. So first we will hear from those who are here to testify. Let me just make sure I covered everything. Yes. All right. So is there anyone else who would like to testify orally? If not, then you may proceed, sir, and please state your name for the record.
Hafaday and good afternoon, Senators. My name is James Cooperners, and I'm the Deputy Director for Guam Behavioral Health and Wellness Center. Respectfully, I would like to submit this testimony in favor of Ms. Carissa Pangelinan's appointment as the Director of Guam Behavioral Health and Wellness Center. In my prior and current roles at Guam Behavioral, I've had the privilege of working with Ms. Pangelinan. It has quickly been made apparent how balanced, dedicated, and innovative Ms. Pangelinan is in her work. Her collaborative nature and decision-making ability come with the benefit of constantly seeking ways to improve the lives of our community members without sacrificing her responsibilities to the rule of law. She's been a leader in the department during the most trying times, including managing behavioral health services during the COVID-19 pandemic, Typhoon Mawar aftermath and recovery, and now the current fentanyl concerns. She has prioritized support for children, their families, and the most vulnerable, as well as championed unique solutions to some of the behavioral health treatment challenges our community faces. Ms. Pangelinan has provided a template for what it means to lead. She is well respected by staff both within Guam Behavioral Health and from other departments, both locally and abroad, and is often sought after as a thought partner and solution maker. She is fiscally responsible and is always seeking to leverage federal support to better improve our community. Most important, Ms. Pangelinan has demonstrated herself to be an effective and ethical leader. She exudes profound operational knowledge and care as a public servant while attending to her role as a responsive steward of public dollars. At the same time, she does so while constantly keeping focused attention on the needs of our community. I'm confident in Ms. Pangelinan's ability to continue leading Guam Behavioral Health and Wellness Center. She demonstrates herself to be an experienced, compassionate, and responsible public servant. I look forward to continuing our partnership in improving the island's behavioral health system, and I respectfully ask that this body grant favorable confirmation of her appointment as director. Thank you.
Si Zeus Masi, Deputy Director Cooper Nurse, and congratulations on your appointment as well. All right, before we begin, Carissa, just give me 1 minute. I have, seems like, a lot of written testimony, and I just want to read their names into the record. There's written testimony from Dr. Mary Cruz in support of your candidacy or your nomination. There's a letter from Joaquim Pete Roberto in support of your nomination. There's a letter from Dr. Davina M. Lujan, staff physician at the Guam Behavioral Health and Wellness Center, in support of your nomination. All of these letters have been provided to the senators. There's a letter in support of your nomination from Norman Kidichai, Project Director, Colorado Behavioral Health Administration. He's asked that I read that into the record. I'll hold that and see if we have time. Of course, the Deputy Director, we did receive that in writing as well, Sidzus Masi, and that one. So I think I'm going to read this real quick, this testimony from Norman Kidichai, Project Director, Colorado Behavioral Health Administration. Half-a-day speaker and members of the committee, my name is Norman Kidichai, and I currently serve as project director with Colorado's Behavioral Health Administration. It is with great admiration and esteem that I write to express my unequivocal support for Carissa Pangelinan's appointment as director of Guam Behavioral Health and Wellness Center. Her unwavering integrity, compassion, and comprehensive acumen in the field of human services make her an outstanding candidate worthy of confirmation to lead such an agency. I attribute much of my professional growth and success to the support and opportunities provided by Ms. Pangelinan. I have known Ms. Pangelinan for 5 years, beginning when she served as the Deputy Director of Guam Behavioral Health and Wellness Center. As deputy, she played an integral role in executing GBWIC's mission to lead and foster culturally respectful and inclusive quality behavioral health services that strengthen the well-being of our community with a vision of creating a safe, supportive, and holistically healthy environment for all. Additionally, she has contributed to the successful CARF, or CARF, reaccreditation and aligning the agency with the nationwide golden standard of care as a certified community behavioral health clinic. Throughout our professional relationship, Ms. Pangelinan has demonstrated exceptional leadership and dedication to improving mental health services for the people of Guam. Under her guidance, I had the privilege to serve as a cultural and linguistics trainer, serving families who were homeless or at risk of homelessness. Shortly after, I was given the opportunity to serve as project director for emergency response to suicide prevention, serving individuals who were at risk of domestic violence and suicide as a result of the novel coronavirus. Additionally, I was fortunate to work as a project director for Project Agang, Crisis Services, where, with Ms. Pangelinan's support, we established Guam's first mobile crisis response teams. This initiative provided an alternative response for community members experiencing mental health crises, linking them to appropriate care and reducing the reliance on law enforcement. Together, she steered the department towards the successful implementation of the aforementioned programs and ultimately improved access to care by setting up 24/7 crisis intakes and a crisis hotline that has since evolved into the 988 Suicide and Crisis Lifeline. These efforts have prioritized treatment for individuals seeking support during times wherever and whenever they needed it most. It has been an honor and privilege to work under Carissa's leadership. I am confident in her capacity to serve as the director of Guam Behavioral Health and Wellness Center and to shape the future of mental health services for the people of Guam. Sincerely, Norman Kidichai, Project Director, Colorado Behavioral Health Administration. All right, and with that, we'll hear now testimony by the nominee herself, Ms. Pangelinan.
Good afternoon, Honorable Oversight Chair and Speaker Therese Terlaje, members of the Committee on Health, and honorable senators of the 37th Guam Legislature. For the record, my name is Carissa Pangelinan, and I am the Acting Director of Guam Behavioral Health and Wellness Center, also known as GBWIC. And I am here to testify as the nominee for the position of Director for GBWIC. Before I go on, I'd like to take a moment to recognize some very important people. Actually, everybody in here is important. But my parents, Tony Pangelinan and Edith Pangelinan, my family, dear friends, my deputy director, Dr. Cooper Nurse, and members of my management team and staff. I am blessed to have you all here with me today. I'd also like to thank our Governor, Lou Leon Guerrero, and Lieutenant Governor Josh Tenorio for the appointment and to trust their trust in me to lead this fine agency. Today, I would like to share a little about my journey with the agency through the years, as well as some of the things that I hope to accomplish as the director. A few months after graduating with my bachelor's in political science in 2011, I was hired at then Department of Mental Health and Substance Abuse as the project director for what was only supposed to be a one-year planning grant to expand the system of care for children's mental health. During my first year with the agency, I led the application for a 4-year implementation grant to expand the system of care for children's mental health, bringing $4 million federal dollars into the Child and Adolescent Services Division. Through this project, we started the I Care Guam anti-stigma campaign, which received 6 national recognition awards. We made significant strides in helping young people feel comfortable with talking about their mental health and not to be ashamed to seek the services that they may need. In 2018, I authored 2 more grant applications with the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. One for children, ages 5 to 18, living with serious emotional disturbances, and experiencing homelessness for $5 million, which you might know today as Project Link, and a healthy transition grant for youth and young adults ages 16 to 25 with mental illness for $4.7 million entitled Project Terlaje. I was serving as the project director for Terlaje in January 2019 when Governor Liu appointed me to be the deputy director for JBWIC. As deputy director, my main duties included overseeing the overall operations and administrative responsibilities of the agency, including staffing and HR matters, facilities and maintenance, safety and security, finance, grants administration, training and education, MIS, and playing a very active role in the accreditation process. Additionally, I served as JBWIC's corporate compliance officer, ensuring policies and procedures are followed and setting the mechanism to continue striving toward excellence. I also served as the grants compliance officer, overseeing program and project managers with federal grants to ensure compliance with all federal laws, as well as oversight of appropriate programmatic and financial activities with a heavy focus on making sure we spend instead of return the much needed dollars. I am happy to report that under my leadership, JBWIC today remains in good standing with all of our federal funders. The past 5.5 years were very challenging for us as a health agency that remained at the forefront during the COVID-19 pandemic. As the head of operations, I served boots on the ground alongside the very dedicated JBWIC team throughout the public health emergency. I know you may think I am biased, but JBWIC is comprised of the hardest working and committed individuals I've ever worked with. During this time, we also authored a couple of COVID-19 emergency grants that enabled our agency to expand and pivot services such as the movement into telehealth by securing dollars to purchase computers, HIPAA-compliant Zoom licenses for our providers, as well as a full internet upgrade from the agency to support the increased bandwidth usage as a result of more telehealth services and virtual meetings occurring. Additionally, COVID-19 dollars were obtained to fund the renovation of our JBWIC-owned home on Father Dueñas Drive that then served as the isolation or warrior unit for COVID-positive individuals that met inpatient stabilization admission criteria. It is important to note that although this started because of COVID, telehealth is now a permanent option in terms of the array of services that JBWIC has to offer. In addition to telehealth, one of the first things we worked on during the emergency was getting the 24-hour crisis hotline up and running. Concurrently, we applied and obtained membership for Guam into the National Suicide Prevention Lifeline Member Network, which, because of federal statute, eventually evolved into what you all know as the 988 Suicide and Crisis Lifeline. I want to plug that 988 just celebrated its second year anniversary last week on July 16th. And as of that date, we received almost 22,000 calls, and we are answering at a 93% answer rate. As deputy director, I also played a very active role in our department's budget process, from start to end, from the request to spending. I am very aware of the competing interests across the government for a piece of the pie when it comes to the limited dollars that there are to appropriate. Well over 95% of our funds come from the Healthy Futures Fund, which you may know has been trending downward the past few years due to many smokers ditching cigarettes to switch to vape, which is currently an untaxed industry. Knowing that only pushed us even harder to pursue federal dollars to ensure that the community was receiving the much-needed services. This aggressive pursuit resulted in the hiring of over 80 new personnel, mostly in direct service, meaning that it not only allowed us to increase the type of services that we can offer our community, but also improve the quality of the service that we provide. One of my proudest outcomes as deputy is having the opportunity to teach and mentor a group of individuals who expressed interest in learning the grant writing and management process. Today, they are able to prepare grant applications, and they only have me jump in at the end as a last reviewer before submission. This has brought me so much pride and appreciation for what I get to do and the dedicated individuals that I get to work with. I need to add that just like grant writing is not a typical task for a deputy director, none of these individuals were hired specifically to do this, and instead, they performed this as a collateral duty, dedicating countless hours outside of their actual responsibilities. JBWIC's mandates in Chapter 86 of Title 10 GCA states that we are to provide comprehensive inpatient and community-based outpatient mental health, alcohol, and drug programs and services for the people of Guam, much of which you stated earlier. As most of you know, for many years until November 2019, GBWIC was under federal receivership through an amended permanent injunction. However, GBWIC also achieved its first and full 3-year CARF, which stands for Commission on Accreditation of Rehabilitation Facilities, accreditation in 2017. Since then, we continued to achieve full accreditation. In 2020, amidst the COVID-19 pandemic, and again, this February, earlier this year, while still recovering from Typhoon Mawar. Achieving accreditation is no easy feat, but continually striving toward improvement and excellence is non-negotiable for us. I cannot stress enough what a testament that is to the commitment, resilience, and perseverance of the GBWIC management team and staff. GBWIC has a unique position and big responsibility in our community. We provide services for the severe mentally ill. We serve all the ages, children and adults alike, including those faced with substance misuse and dependence, as well as those experiencing suicide ideations. It is well known that Guam has faced a drug epidemic for many years. Some might even say that not enough is being done to change the tide. However, on the treatment side of the house, GBWIC, through our New Beginnings program, provides drug and alcohol services ranging from ASAM level 0.5 to 3.7, meaning from education through to the inpatient intensive detoxification, including a medication-assisted treatment program and a residential program for postpartum and pregnant women. In addition to the internal programs, GBWIC contracts services from very important community partners such as the Salvation Army, Sanctuary Inc. and West Care Pacific, and TOGI. The contracted services include residential rehabilitation and social detox substance treatment for adults and adolescents, and outpatient and intensive outpatient substance use treatment for adults and adolescents. The reality is, drug interdiction, law enforcement, and substance use treatment are equally as important. Each of our systems and agencies need each other if we are going to overcome these challenges that plague our island. In addition, prevention is key. GBWIC's prevention branch currently has a robust program that offers a series of trainings that aim to educate natural helpers to recognize the signs and symptoms. Additionally, you can call 988 24 hours a day for you or your loved one, or the TOGI Warm Line at 787-9726 or 686-9726. For the next 2 years, there are 3 things that I want to accomplish if I am confirmed as director of GBWIC, and they are: number 1, to expand the drug and alcohol services. First, by way of the social detox bed expansion for men, single women, and women with their families. As part of this goal, I also want to establish a certification program in collaboration with GCC for substance misuse peer specialists, where they can receive formal education that complements their lived experience, and the resulting certification or degree will incentivize full-time employment with GBWIC or any of its contracted service organizations. I would be remiss if I did not mention that a very important piece of this expansion is to collaborate with other partner agencies to tackle the transitional housing need. Many of our clients successfully complete our residential or social detox programs to include our DOC RSAT program, and upon completion, as they transition to outpatient or aftercare programs, they are challenged with not having a healthy place to live while they continue through with their recovery. Number 2, I'd like to grow our behavioral health workforce through a multi-pronged approach by A, creating clear pathways for professional support staff. In addition to continuing our partnership with WICHE for psychology doctoral interns and the partnership with the University of New Mexico for psychiatry residents, I want to expand this to include a nurse practitioner residency program with an emphasis on growing the number of psychiatric mental health certified nurses on Guam and in the region. GBWIC proudly employs the only 2 PMH MPs on island, and I have already begun an email exchange with the Waianae Coast Comprehensive Health Center's director for the nurse practitioner program. I am also happy to report that we have recently hired 2 psychologists, as recent as last week. We will also be starting our second cohort of 2 psychology doctoral interns on September 3rd. Our second psychiatry resident will be coming in January for her 6-month rotation, and for the first time, we will also be receiving a child fellow psychiatrist in April. B, I would like to establish a social work and counseling internship program directly linked to the University of Guam programs that will result in automatic hiring upon completion of specific education plus on-the-job training requirements. I was recently invited by the Dean of the University of Guam's College of Liberal Arts and Social Sciences to be a member of their inaugural class advisory council. Our first meeting was in April, and I already discussed with the deans and the division heads that this is something I want to make happen. And C, I would like to revamp the psychiatric technician positions by updating the job descriptions and incorporating certification incentives. GBWIC heavily relies on psych techs in our 24-hour crisis stabilization units, as well as in our residential recovery homes. And the third goal would be to increase access to care by way of A, ensuring that we have the capacity to provide the services, and of course, not just within the GBWIC agency, but through our community partners. B, raising awareness and informing the public of available services with the emphasis that treatment works. C, exploring opportunities to be able to leverage local and federal supports to provide these services when people need it without them having the added burden of figuring out how to pay. And D, collaborating with other service systems that could be considered natural referring entities and making clear the processes for warm handoffs to occur. I hope that by sharing what I have done so far in my time at GBWIC, as well as a few of the goals that I have for the rest of the term, I have gained your support and vote of confidence in my ability to lead GBWIC. And I will close with this. I'm confident that I can do this. However, my confidence doesn't come from ego or arrogance. Instead, it is fostered and assured by these three things. Number one, I am grounded in my faith, and I seek the Lord for wisdom and guidance in everything that I do. Number two, this solid and wonderful support system that you see behind me. And number three, my desire and commitment to not only be a good steward of what is given to me, but to lead a life of service to my island. This concludes my testimony. Thank you.
Thank you very much, Director, for your testimony and for your work over the years. So since I became the Chair of Health, I remember we had a meeting and you outlined your plans for behavioral health, and you had only been there for a little while at that time. And one of the priorities was getting off of the receivership, which you did, and then all the other things, the standing up the mobile crisis response, which you did, and many of the other things as you listed in your testimony or that was talked about in the other testimonies. I agree. Those are great accomplishments. I think your testimony is also, I like the fact that you highlight what your plans are. So thank you for being thorough about that. And I think the Guam Behavioral Health and Wellness Center is very, very lucky to have somebody as familiar with grants as you are, as willing to work with them as you are. And we, the people of Guam, are benefiting hugely from your efforts with these grants in obtaining more and also making the best use of the ones that we are receiving, and to continuing to look for these and to apply for these. And to train people in this work it's one of our, I would say, our weaknesses to not be strong in this. And so being strong in this is really a huge advantage for the agency and for Guam. And this is in all critical areas. So what you're working in is huge critical areas. So I have a couple questions, if I could just ask you some very specific ones. First of all, these recommendations that you made are the ones that I also have been discussing, so they're perfect, I think. This, the revamping the psych tech jobs so that we get them and they're more attractive is good. There seems to be not a perfect fit between the graduates and Guam Behavioral Health of all places, with psychiatric degree graduates as well. So, so I see you're doing that with the social work, and I think they have, we tried to take care of that in previous laws, right? Where the social workers, they have a path. But I think, yeah, doing that with psych grads as well would also be helpful. but I'm glad that you're working on these things. I just hope we get it really concrete, right? While you're the director. The efforts to recruit people from off-island, this has really been, the hardest thing, I think. You're in a field where nationwide there's a shortage and a high demand, so we have to be attractive, we have to be fast, and it looks like you have done that to try to attract them here by allowing them internships. I know the previous director had allowed, made sure that we qualified to be in some of the programs that would, erase their debt, right? Or subsidize that. So thank you for all those efforts. And this, I'd like that you also highlight like how far your work's going to take us, and then the work that the rest of us all have to do, such as that transitional housing need is all of our work. While you are in charge of residential rehab, outpatient rehab, all of that, drug interdiction is key. It has to be law enforcement, has to be equally important. And so I agree with you. We are not going to solve this by treating everybody. We cannot. We have to stop the drugs from coming in. We have to stop it. So thank you for also highlighting that in your testimony as well. Can you just tell me the difference between the 988, 24 hours a day, or the TOGI warm line? TOGI is for particulars purposes? Yeah,
TOGI is run by peer support specialists, and they are specific to substance use and concerns regarding addiction.
All right, and the 988?
988 is for suicide, all suicide and crisis, right. And high stress situations.
Okay. Yeah. I just want to report that when I get calls and people ask me for help, I tell them to do this 988, and I've actually got calls back, and they say that actually helped. So I just want to put that out there, that seems to be helping, and 22,000 calls since, in 2 years, that's pretty good. I mean, not good, but it's a lot of work. So hopefully that will continue to be successful. Have you heard anything about, I was looking at the statistics from the coroner, first of all. He gave us a report, right, on what he had seen, the deaths, how much of them had occurred because of drugs, and what he had seen. I also asked the emergency room for that as well. So they gave us their statistics. But have you heard any incidences of where you get a kind of emergency intakes at your place and then treat them, and part of the treatment is drugs, but that they have to be referred to ER because of too much medication?
It would actually be the reverse. Well, I mean, we have pathways both ways where you can come from the emergency room over to Guam Behavioral Health, and then if they were to come to Guam Behavioral Health and it's a medical crisis that is outside our capacity, then we would refer the other way. So yes, we have seen that case. But I did want to point out about the data from the emergency room and the coroner. So GBWIC, up until I want to say last month, was not privy to the information until, like, we get suicide data, for example, after the year is over. In this case, through our SPIF-RX, which is the Strategic Prevention Framework, it's an opioid grant that we have gotten into an agreement with GMH and the OCME to now provide us the data as it comes. And the reason why we're getting into that partnership is because our SO, which is the State Epidemiological Outcomes Work Group, led by Dr. David, is now going to look into the illicit drugs data to help us. It's basically going to add to our EPI profile, which usually is just with the suicide data. Yeah,
that's great. I was also going to ask you. I know you're part of putting out those reports on the epidemiological, but how has that impacted your work or made any changes? But before we go there, just back to the ER, I'm talking about where you are, the department is treating patients for, I don't know, overdose or just drug abuse. And when in the use of medication, they need to be referred, not on an intake, but after treatment, they need to be referred to the ER because of too much medication or something like that.
Too much medication prescribed by our providers.
Yes.
If that were ever the case, then the process would be that they would be referred to the emergency room.
Okay.
Yes.
Yeah. Have you heard of those kind of incidences?
Not anytime recently, no.
All right. Could you just double check? Someone
Sure.
said that to me. I don't know how reliable that was, and so I
Sure.
just want to make sure that
I
that's
can definitely
something
look
that
into
you have a handle on.
Sure.
Okay. So back to the reports, the epidemiological, those are all kinds of statistics regarding usage of smoking, drugs, things like this, particularly in the youth. Have you made changes in your programs because of that data?
Well, what it has really shown us is that when we're tackling suicide, for example, and substance misuse and dependence, we really need to look at it as the social determinants of health as a whole. And so it's not just a person's mental illness, for example, that it's all the non-medical parts of their life that affect it. And so I can give you an example in our recent EPI profile, which was 2022. This was data coming out of COVID. And we actually showed in 2021 like a slight decrease in the suicide deaths, and the SO was attributing that or correlating that to the fact that during the COVID-19 pandemic, there was like a windfall of money, for example, and the government's efforts were to get these out to the people, and so the SNAP expansion or maximizing SNAP, for example, emergency rental assistance, the housing assistance fund, and like being able to just kind of address what are your basic needs, right? All those other determinants that affect your current health status that are not health related. And we're correlating that to the decrease in the suicide number of that report. And you can see that in our EPI profile that was published on our website and distributed last year. Yeah.
What are some examples of those non-health?
So like housing, for example,
Oh,
right?
I see. The
being
ones
able to
that we
give,
put out
even
assistance for.
childcare. For
Okay.
example, childcare, there were programs that were coming out to help with childcare tuition. The program in Pangelinan, for example. So we're addressing, the government is addressing these other needs that people are having that might contribute to the underlying reasons why somebody suffers from depression, for example.
Okay, thank you. And as the drug treatment, what is our status? Like, you say you want to expand, but can you be more specific? What are our waiting lists looking like and things like that?
The expansion is more so on the beds, the bed space, right? So we have beds in our intensive detox, which is in our main facility, and that's active withdrawals. And when a person is no longer needing that intensive level of care, they're going to need to move into now a lower level of care. Sometimes that's into the residential programs that you might know, like Lighthouse Recovery Center, for example. But it's after those programs. Where do they go after that? So even if they are in our outpatient service, for example, if they're going back to an environment that might have contributed to them being dependent on substances in the first place, or maybe easier access to it, then we can almost expect that, right, the treatment is no longer going to be effective.
So what are you looking at?
So we're looking at needing to expand the beds first, which is that kind of middle level of service. There's the education and that social detox part and the intensive side. So we have our current New Beginnings program is running what we're calling the Center of Hope. And this is, you guys might have, you might remember the Oasis Treatment Center back then, which was for women. So when that contract ended and we assumed the services, right? So we're providing the services in a home called Center of Hope. Our data lately has shown that there has been better outcomes and success when we allow these women to keep their babies and children with them during the treatment. And so now this is evolving into what's basically being considered family treatment versus just treatment for women. And so the expansion would be to which we're actually working on, and I think August 9th is the date that the announcement for the RFP will go out for the single women's services, right? So we have some players on island that have already said that they want to provide these services, whereas Jibwick would now focus on the family treatment side and the ones with the kids.
All right, and what about for the transitional housing needs?
So that's kind of what I was talking about.
Okay.
When they get out of these, so all our programs are structured.
Yeah.
I mean, you know, we have programming the whole day. You're in there for months, for example. It's when you get out of that structured environment and you're now into the outpatient services, which is a little bit less contact, the government needs, the island needs to provide spaces for these folks to be able to live where it's healthy and safe for them, and they can begin to get back on their feet, pursue jobs, right? Maybe education, and
Right.
take care of their families.
So I know this has been talked about in several other forums, but so what efforts are you particularly promoting or familiar with, or are you not going to be involved in those?
We would definitely be involved, I think, more so as a feeder into
The feeder for sure, yes.
Feeder for sure. And also, I think that we can play a role in continued programming, right? I mean, we might not be the managers of the home.
But is this being led by anyone? Like, is Gura or anyone going to lead us into transitional housing?
We recently had a visit with 40 federal family partners last week, and the regional director of HUD kind of heard our presentation as we were taking her through the facility tour, and she said, all I keep hearing is that you have all these housing needs. And so she left us with her, she had to fly out the next day, but left us with her card and basically said to reach out to her to see how they can provide those services. But this is also understanding that HUD comes with many restrictions, right? But it's not worthless for us to try and pursue a relationship with HUD to help us address these needs.
All right. Situs Masi. I'm going to hold the rest of my questions until after the rest of my colleagues. So Vice Chair, Senator Brown. All right, Senator Taitikwi.
Thank you so much, Madam Chair, and good afternoon to my colleagues, but most especially good afternoon to Guam Behavioral Wellness, who's here, your family that is here, and to you, Ms. Pangelinan. I'm in awe of your testimony. Usually when I come in, I write down all these questions before listening to a person's testimony, and you've hit all the boxes that I was going to ask in your testimony, and it's very impressive. What really stands out to me is your grant writing ability. You are considered a rare find to find people who know how to write grants. So a great asset no matter where you go. I'm sure the governor probably wanted to put you, at least could duplicate who you were, to put them in all the other agencies to try and find funding. But that's, I hope you continue to do that. I mean, your plate is going to be quite full. I just hope your deputy can keep up with you. He's also a grant writer. Oh my gosh. Okay, I wouldn't say that very loud because you may get transferred or offered more money somewhere else. Unfortunately, grant writers are really hard to find. If you want to make some money, just be a grant writer, you know. But no, I'm very, very impressed with your resume too as well. I was so hoping that the person that's going to be in this very critical position and oversee the health of our community, special mental health of our community, is somebody with experience and background and has been at the agency for quite some time, and not somebody just picked from somewhere else and thrown into this department, which is, like I said, very critical. And I'm so glad it's you. I appreciate everything that you've done. Just in case the listening audience, you know, has not been able to read your resume, I mean, it's just amazing, your publication, being able to publicize a 2013 system of care for children in mental health on Guam. Being able to publish something like that is very impressive. 2011 to 2003, project director of Para Toru, Guam Behavioral Wellness. That's a big feat as well. So I'm just, usually I give everybody a hard time, but for you, I can't find anything wrong. It's very impressive. And I'm wondering what we can do to help you. You have so many great ideas that you want to push forward on. Do you have an attorney that is assigned at your agency?
We are very fortunate to have attorney Phil Torres, who is actually contracted with the Attorney General's office. We've gotten a lot of support. So when our contract manager is here, she can attest to this too. Our contracts get assigned to an AAG, for example, and we see a nice turnaround. But for every other thing, so in the civil service or in our court hearings and having to file for client stuff, it would be Attorney Phil Torres, and he's pretty accessible to us.
That's very good, because usually that's where the bottleneck is.
Yes, we're very blessed to have him there.
Okay, so we keep that, a grant writer and an attorney. Those two things. The other thing I had a question, I know that the speaker touched on it, is on residential, and I know you have a residential recovery program.
Yes.
And this program is almost similar, because we know that some of these residents are in the community that you house them. So what is the status on the residential program, recovery program?
So we have three, and there are different levels of care depending on the mental illness. But they're fully staffed. All three. We own two of the buildings. One is Guma Azucena, which is located in Asen, and then we have Guma Serenidad located in Agate, right next to the police station. So we own those two, and then for our third one, which is our highest level, we're actually renting. We've been renting that home since we were still under the federal injunction, and we've been actively looking for a home that's actually closer to the Tumuning area, because it's located in Derido. But we're having a hard time with realtors and landlords, or not realtors, but the landlords
knowing what kind of facility it is.
Being open to housing our residents. So for now, we're still in the same location in Derido.
Okay. Can you tell us a little bit more about this program?
Services?
Is it for individuals with
severe mental illness?
Okay. What about those who have an addiction?
So we do have residential services for them as well.
Is it the same type of program?
No. Earlier
Okay,
I mentioned the Center of Hope, which is for women and their children. And then we contract out with the Salvation Army for the Lighthouse Recovery Center that serves the men. We also contract with Sanctuary and West Care to handle the Sagan Nahomlu, which is for the adolescents. So there's drug and alcohol residential services for the youth as well. And the Center of Hope is the only residential one that Guam Behavioral is actually operating internally. The rest are contracted services.
Okay, that's, I've always hoped that one day that we would have a really nice facility for those who are recovering from alcohol or drugs, any kind of substance. And, everybody knows about the Betty Ford, and how all the movie stars are able to go to a facility to get cleaned up. And I was hoping that one day that we could have a facility like that, because the recidivism of individuals who have an addiction is huge. Yeah. Is huge. And many times we're seeing that, even families are saying, oh my gosh, the best place for them to go right now is jail, because they will get cleaned up. Yeah. We were just talking about that yesterday for a bill that I have that would actually provide it'd become a crime and add more sentencing to their jail time if they're caught under the influence while in jail, and they're finding out this is happening, but they can't seem to find the substance or, like any drugs they were doing or alcohol. They didn't have it on them, but they're obviously under the influence. So I'd hate for our community to, say things like that, that the only way for my child to clean up is to go to jail. And I'm so hoping that one day that we'll be able to provide a really nice facility like the Betty Ford clinics, like all the other ones in the States, that would lower down the recidivism of those individuals who continue, to take drugs, and they come back, I'm just in awe, though, about your efforts that you're going
If
to
I
do.
may, I can
Sure.
put in a plug for the Salvation Army.
Yeah.
They have recently built a brand new facility for women. It's called Guma Famalawan. And so, you know, they do need funding in order to set up the program in the home.
Are you able to help fund these
Yeah, and
nonprofit
so I mean, they are
organizations?
definitely open and probably one of the bigger players on island to be able to put in an offer for the RFP that it will be going out on August 9 for women services.
Okay,
Yeah.
that's good to hear.
Yeah.
That's good to hear. So that was one of my concerns, and congratulations on your accreditation. Is it every 3 years that you have to be accredited?
It is every 3 years, and the one that we just finished in February was actually late because of Mawar, so we're up
Okay.
again in 2026.
2026.
Yeah, but we're ready.
Well, that's good.
We're ready today.
You're ready, and you look behind
Yeah,
your support group back there.
We don't let go, right? So
Okay. Well, most of my other questions have been answered just from your testimony alone, which I greatly appreciate it. This is one testimony that I will keep. And whenever I need to give you a call, or if I'm having issues with any constituents, I will read yours again to see if there's anything that you're missing in here, but I'm pretty sure you got it all in here. So I wish you the very best, and I'd like to thank your family for allowing her to take on such a big responsibility to our island and our people, and you should be very proud of the work she's done and what she's going to do for the future of Guam as well. So thank you. Okay, thank you, Madam Speaker.
Tijusmasi, Senator Taitukui. Vice Chair, Senator Brown.
Thank you very much, Madam Speaker. Certainly good afternoon to you, Ms. Pangelinan, and all those that are here on your team to support you. You know, we're at an interesting time here in our island because at one end, we are dealing with such a serious drug crisis on this island, and I was not supportive of the recent cannabis bills that came through the Guam legislature because I think as leaders we need to set the example. And I think encouraging our people to become dependent on substances. I mean, I don't smoke, I don't drink, I don't, you know, very rarely will I have a glass of wine, or I used to enjoy margaritas, but as you get older, it's less, you know. You can't recover from it as well, so I just don't bother anymore. It's too much effort. But I think that all the issues that our people are dealing with, and at a personal level, but also as a community level, a lot of the crime and everything else we're experiencing is drug-related. And I don't know to what degree, and maybe you can give me some insight, you know, can the government address that? Because I think government has its limitations as well. And also in funding. I think it's great when you're able to get and appreciate your abilities with regards to grant funding. But the costs and time and effort and the resources involved in the recovery, I'm sure from your own experience, is quite extensive. And to what degree are we successful with that? Because at one end we're saying this is not good, but then we're passing policies here that make it acceptable. And I'm sure the misuse of these drugs are going to just permeate, as they have with other drugs, into our community and down to our children. Because we look at the vape problem we have now and the amount of children in our schools that are, you know, getting in trouble because they have vape. And the schools are going, well, what do we do with all this collection of vape that we've confiscated from students that should not be using it? And so the bigger issues now that, you know, we know that crystal meth has so permeated into our island, and it's not isolated little pockets. I mean, it's in areas that we never imagined. And it's so cheap now. It's probably cheaper than going through the fast food drive-through, which is pretty pricey these days. So I wanted to get your feedback on that, because I'm of the opinion we should set the example, but my colleagues decide that that's okay. The fact that our people, more of our people, should be in a state of where they're really not there. You know, that cannabis is acceptable. Alcoholism, to extent of abusing it, is acceptable. Drug use is like sort of normal. And I don't know who are the responsible people in our community is supposed to carry this community and this island and build us and move forward and raise children that we are now seeing as a result of this pandemic of drugs and other type of substances are suffering from. How are we going to address that? Because government is not a mommy and daddy that is caring and, you know, can embrace you and deal with you, even though I see our community now that thinks the government is the begin and end all of everything. And we can't provide that. There are limits to what we can do. So what are your thoughts of to what degree are we able to do that? And I know Senator Taitukui brought up the recidivism rate. You know, how are we able to successfully do that? Because sometimes people that get dependent on these drugs, they're more vulnerable to it. There are other factors that create that circumstance, and that it's very hard sometimes to, how do you shape their abilities after to be able, like you said, to be able to be independent and stand on their own and get back to some sense of what we would call normalcy in our community and be employed and productive. And I know it's a big question, but to me it's probably a very pressing question. A lot of people out there, including those that have family members that are suffering from these type of abuses. And it's prescription drugs, I mean, the list goes on. You know, why do we all need to be drugged up on something to function? That's scary. Because somebody's got to be driving the bus, you know, somebody's got to be in charge. And, you know, if we're high on something or we're dependent on some of these substances have long-term effect, can affect their mental capabilities down the road, their physical capabilities down the road because of this long-term abuse. And then who's supposed to be responsible for it? Is it the individual, their family, or then it becomes a responsibility for the people of Guam? Because the reality is, as we know, there's no endless amount of funding, and the current ride we've been on the last few years, I don't think is going to last. And then who's going to pay for it? Because I'm sure treatment is not an easy process, so I want to get your thoughts on that.
Well, I think the short answer is that it is all of our responsibilities as a community, because there's not going to be one agency that can cure all. Guam Behavioral Health and Wellness Center, I think that we do a good job at providing the treatment. Can we expand and increase? Absolutely. I think that you have the law enforcement agencies, the Customs and Quarantine, and everybody has to beef up their drug interdiction, right, and the law enforcement. And I think this body has also passed legislation that made sentences stricter, for example, for those who are caught dealing, right? And so those are things, cut the supply, but we need to be able to meet the demand then of those folks who are going to come in with active withdrawals. And so it's really not a one agency, one person solve. And you know, when you look at the states and you kind of see the different states that are dealing with the same epidemic, some of them are 20, 30 years old, and they probably have more funding than we do. But one of the things I think that Guam has is, it's really the fabric of the community is family. And so we need our families to step up too. When you see a loved one who is using, encourage them and bring them in to get the help that they need. Cut it off before it becomes the crisis, right? And a lot of times, like you mentioned earlier, it's not until they go to jail. It's not until they're, and we're there too. I did not mention that in my testimony, but Guam Behavioral Health is very active in the Department of Corrections as well. We're providing inpatient, outpatient, and residential treatment. Right? And so we're trying to help the folks that are in there so that when it's time to get out into the community, that they've at least been through some type of treatment to help them. We're trying to help people, set them up for success. And we won't be able to help everybody, but I think that if we remember that treatment works, prevention works, you know, and this type of stuff, and we continue to get the support of the body financially, which you have, we just got to keep chipping away at it, and the hope is that eventually we can eradicate and bring it down to a level that is not considered a pandemic or an epidemic.
What's not often talked about publicly is the rate of suicide on Guam. It's not publicized. I mean, if someone dies of suicide, more than likely they don't publish it to recognize the rates of suicide. And I certainly appreciate our medical examiner providing us the information earlier this year in terms of his findings of those that have passed away, the amount that may have passed away as a result of being on these type of drugs, including those that are in suicide. In most cases, almost all of them have some type of substance in their system, including cannabis. I remind my colleagues, because they say, oh, cannabis is not, it's negligible, it's not an issue. And I don't think it's that simple. I think, the fact that those that are or have been successful in committing suicide are on some type of substance. What are your thoughts on that? Because we're seeing younger people, and I'm also seeing in our community, which is bothersome, is the middle age, not middle age in terms of age, but the middle part of our age group in our community. You've got the younger ones, the middle ones, and then of course the elderly, is grandparents that are in their 70s and their 80s that are raising their grandchildren, because those of us that should be responsible should be adults, should be taking care of our children. That, you know, you would think, how could you bring your children into the world and not care for them, not make them the first priority? That is the expectation, but we're seeing more and more of our children in our community that are just, for whatever reason, most of it because of addiction, that are being left behind. And the elderly who are just probably challenged to take care of themselves with their health issues and everything else now are having to parent their grandchildren because of this big void that responsible adults in our community, and I think sometimes we just need to acknowledge that and hold people responsible. I mean, at some point, we can say we're victimized by something, but I think at some point we got to say, wait a minute, we got to take responsibility for this and hold others accountable. What are your thoughts in the trends that you're seeing here in our community? Because that's my observation from over here. I'm not a professional, but I'm seeing that as a growing problem and a bothersome one, because those that are most productive in our community, those are the ones that are dying now from drug abuse. Those are the numbers. And when you look at obituaries now, you're seeing, my goodness, they're in their 30s, their 40s, the most productive, you know, ages in time in their life, and they're passing away because of this drug addiction and passing away as a result of the use of it or overdosing from it.
So the first part I'd like to say is going back to the social determinants of health. It's crucial for us to, when we look at an individual who is dependent on substances, for example, we need to evaluate what is really going on around the person, what is going on within the person, what has caused that person to use in the first place, right? And kind of addressing all those non-medical and non-treatment challenges should help them be more successful when they do come in for treatment. On the other hand, I mean, this is just a personal statement and not necessarily from Guam Behavioral Health, but I feel like cannabis, any type of drug that is not used correctly, that's why we use the word misuse, has the potential, whether it is prescribed by a doctor for after a surgery, anything that is misused has the potential to be a gateway for addiction, right? So we heavily rely on all these things, and maybe it was prescribed to you the first time because you had a surgery and that was it, and then you became so dependent on that. So there is potential in every drug, whether it is an illicit drug, a prescribed drug, cannabis, meth, you name it. All of it has the potential.
So what efforts can we do with regards to prevention? Because unfortunately, a lot of young people are not getting that at home. I mean, I grew up in a generation where my parents just had to give me the look.
Yeah.
They didn't need to talk to me. I think all of us did. Before cell phones, I mean, if I messed up before I got home, my parents knew about it.
Yeah.
Thank God I didn't do it often, otherwise I'd always be in trouble. But if we're having an issue with already vape abuse in schools, what more all these other, you know, if they see it around, they see their parents engaging in it or older siblings, the odds are probably fairly good they're going to be influenced by that.
It's another multi-pronged approach. And so on our prevention side of the house, you know, being able to contract out to these community grassroots nonprofit organizations to be our feet, our boots on the ground in the schools. This is where we're going. We're providing the education, the prevention type of education in the schools. We provide trainings, multiple trainings. These are layman type trainings. We're not training certified clinicians. They have their own medical school to go to. We're talking about the nanas and the godmothers and the godfathers. We call them natural helpers. So anybody who would have access to or spend some time with these young people. We all, as adults, play an active role, right, in raising a child, whether they are ours from birth or not. And I mean, it's considered a protective factor to have at least one adult who cares about you. And so, again, going back to the fabric of the community, being family-oriented, but really carrying the weight as well, that this burden is not a Guam behavioral burden, it's not a GPD burden, it's the communities, it's all of us that have to, we each need each other. We all need each other. One is not kind of more important than the other.
Well, I hope that message gets out there because, you know, I mean, I was in my early age, 5, 6, 7 years old, and we had the heroin epidemic, but it didn't migrate and dig deep into our community to the degree we're seeing now with crystal meth. And that's what's scary. It's just the fact that it's so cheap and who's dealing with it now and who's the dealers out there. It's not, you know, it has permeated, I guess is the proper word to use in our community, and that's that's very concerning, because I think we can end up with a whole next generation, as you said, unless we're very effective in either removing the source, if it's being generated here, or if it's coming into the island, because we talk about it, we see the crimes related to it, but I don't think we're as, even at our level, I don't think we're as conscientious of how we're helping to contribute by simply thinking that, it's okay, cannabis is okay, well, alcohol's legal, so it's okay. And somehow we're growing, because you don't have, you can't have a good time unless you have a drink or two. That's what we all do when we get together, right? That's how we're supposed to celebrate, and it's so accepted. But as you mentioned, to the extent of abuse that we're seeing in our community, and why is that happening? And why is it happening with as many people? We live on a beautiful island. We have many opportunities here, and you got to ask yourself, why is it most of our people want to go around and be drugged, drunk, whatever the case may be, and none of that is productive to a good society. So I certainly wish you well. I like your candor. I wish we had more appointees like you. I think the governor could use more appointees like you, because we see all of your directors, and beyond I need more money, I don't have enough resources, and that's the end of the story. And I hear that repeatedly. We hear that during the budget hearings, and I got to wonder, and I'm scratching my head going, really, God, I qualify to be one of those directors if that's the only thing I have to bring to the table. So I wish you well. You have quite an undertaking, but the burdens are heavy. And I'm sure all of you that work in this field have to have a heart to do it, because it takes extra special patience, because you're dealing with people and you're dealing with their struggles, and we're seeing such a large amount of that pain in our community right now, and so many of our people are suffering. As you mentioned, I like your more holistic approach of where you can assist the family, because it may be a loved one, but everybody else somehow, some way is suffering as a result of that, because you don't want to see a loved one hurting themselves, but the subsequent response is that it ends up hurting all the people around them. So good luck. I mean, you've got quite a challenge, but I appreciate your interest in wanting to charge forward with that. So thank you. Thank you, Madam Speaker.
Jesus Mossy, Senator Brown. Can I just follow up with a couple more things? So one is, are there waiting lists for these? You're partnered with Salvation Army, Sanctuary, Inc., Westcare Pacific, Togi, and to do outpatient, or I don't know if you call that outpatient, both
we
inpatient
have
and
outpatient and inpatient
Okay,
services.
residential,
Resident,
right?
yes.
So,
there is.
And you're looking at an RFP to come out in August for a single woman's unit, so that will
Correct.
expand your ability.
Correct.
But even with that expansion, are there waiting lists, or do
There
you
is
expect
currently a waiting list
Okay.
without that RFP that
Okay.
has gone out because of, I wouldn't say it's because of our transition to the family treatment, it's just that there's just that many people in.
Okay,
And so for example, if Guma Famalawan were to be fully funded, I believe they have the capacity for 15 more beds, Athena, right? 15 more beds. So, I mean, if you're looking at a wait list of 20, you already
What is your
tackled more
wait
than
list?
half
What are
of
we
it,
looking at?
Probably around 18 to 20, yes.
20 is the current
Yeah,
wait list?
about 18 to 20
So that will take
women.
the current wait list for treatment. 39. 39 in wait list. We're opening up about 15 more beds. Yeah, so my next question was going
They
to
need the
be,
support, yes. And then the expansion that I was talking about as part of one of my goals.
yeah,
We have identified the cottage homes in Talafofo.
Mm-hmm.
We already secured some Department of Interior money that can help to start the programming, but what we're going to need, of course, is the continued support from there, yeah. So
Okay.
that's kind of the more immediate help, but the place needs to be refurbished. So our clinical administrator and I, we went in early 2023, we took a visit. The place is ideal. There's a men's and a women's. There's acres of land that we can turn into farmland. We can create some type of industry for the folks that are there. And it's very therapeutic as well. However, Typhoon Mawar made the condition way worse than it was when we went to visit it. So it's going to take a lot more work, but it's not something that is lost on us. That's why it's here in my first goal to expand. It's to expand those beds.
Okay.
That's the beds that we're looking at
okay.
expanding.
So the cottage home, is that been transferred to behavioral health already?
Yeah.
It was DYA, right?
Yes, that's correct. Which they haven't used in
Right, but is it transferred?
about 2 decades. Gura is in charge of
Okay.
handling that paperwork.
And then does that, the equipment that you requested for in your budget, you said furniture and appliances for our residential homes that house adults with serious mental illness.
Yes.
Furniture and patient beds for crisis stabilization units, adult and child units, and Healing Hearts.
Yep.
But, so what about for that place? Or you're getting DOI money for that, or for the cottage homes?
We need to get the place refurbed since
Yeah.
all
How
the damages.
soon do you expect that to occur then?
So Gura is the handler
Gura.
of the, yep.
Okay. I know because I've heard this talked about for a while
Mm-hmm.
now. All right. If you could follow up, just let
I
me know
will.
what we're looking at. Because how many beds do you expect to open there?
It has two separate facilities with like a common cafeteria. I don't know, Athena, if you know how many, each, right? Yeah.
20 beds. And how many, is that where you're expecting to put the women with children?
Right now, we're renting in Tumuning, which is close to our facility, and we're in the middle of searching. So Athena, our manager for drug and alcohol, is in the middle of looking for a bigger home.
Okay.
Right, because it's the one with the children.
If you can find one, you can.
It's stay in, we're ideally to stay in Tumuning. The
Okay.
cottage homes, what we're looking at is the services to be contracted out.
Okay.
So that won't be run by
All right, and that's not for the one with the women and the children is for drug treatment.
Correct.
Okay, and so we're hoping to expand that soon by how many beds?
It depends on the home that we can find to
Okay,
fit.
yeah, because I am concerned, we do get calls about the waiting list.
Yeah.
And so can you just recap, if a person is suffering with someone with drug abuse in their family, what are their options? One is to call 988,
Yep.
maybe get that person to call 988?
988 or the warm line from Togi.
Okay, the Togi
Those are
warm
24
line.
hours.
All right.
But so is our facility.
Okay.
Right, so if
And you said to
you
bring
can
them
bring
in?
them in, you can.
So is that how do you describe that? Like, is that a voluntary, involuntary?
Absolutely voluntary.
Okay.
All,
So they have to agree
they
to
have
go
to.
in with you?
In fact, we have folks who are in the unit, for example, and decide, I no longer want to be here for treatment, and we can't stop them. It's a
Okay.
strictly voluntary service.
I'm just trying to show families their options, so that's the
Yes.
hard one, right?
Yes.
When it has to be voluntary.
Yeah.
Is there such a thing as involuntary?
There is, but not on the substance use side. That would be on the psychiatric
Okay.
stabilization
All
unit.
right. And do your partners take these substance abuse clients directly, or do they all have to come
They
through a
would funnel
referral?
through us. Yeah.
All right. And are there any others that do direct services out there besides going through a referral with you?
Directly, not, I don't know who, you might know
Okay.
more players.
So
No,
you are
just
the
our
number one
contracted-
option?
Well, we're the
Only
point of
option.
entry.
Okay, point of entry, got it. Unless the court, right?
Orders,
Unless you get arrested, go to
which they
court,
do,
and they
Well, if you get arrested, it's also going to be behavioral health.
yes, that's what I mean, then they're
in
going to
there.
mandate you to go to one of these services, okay?
Yes.
Or you're going to be at DOC
Yeah,
with Guam Behavioral Health.
yes.
Okay. Are there any other strategies for families dealing with that?
Strategies. I mean, I will keep stressing that the housing need is another crisis. How about that? I'll
Okay.
put that on the record. There is a housing crisis.
Yes. Yes,
Right.
there is. Okay, thank you. Senator Cananta, did you have any questions for the nominee or comments?
Thank you, Madam Speaker. Certainly just support you. I'm very happy that you've stepped up to serve our community more further. And congratulations to your deputy. I wish him all the best. You have a lot to keep up with. I'm very happy to see that you're a former Youth Congress member. Certainly very proud to be a Youth Congress alumni as well. And I'm very happy to know that you came back to serve your community after getting all your educations off island. I mean, your higher education, right? Yeah, so your career path is very, very long and lengthy and very experienced. So, I have no questions on your service or your appointment to the agency you will be serving. Again, there's a lot of great things that you've accomplished within your tenure there. And I look forward to hearing more fruitful stories from your members and your partners here that are all supporting you very feverishly. So, and your parents are very good guiding lights and, your faith. I mean, Yeah, there's no questions for me. I wish you all the best, and I look forward to hearing from you. If there's any legislation you need, your oversight chair is a very supportive oversight chair. But other than that, my office stands ready to support if anything are needed, right? Thank you again. Have a great day.
Senator Kanata. So one more time, Ken, I just want to get a very realistic counting of what we're looking at. We're looking at, we have all these different treatments, yet we're still looking at waiting lists. We are trying to expand.
Athena said about 39.
For women.
Yes.
Yeah, we're trying to expand, and you have the plans, and you have some money. And for men, what are we looking at?
So we have some money,
Okay.
but I would say again that the Salvation Army does need that support. So whether the money is appropriated to Guam Behavioral Health to add to the contracts that we're putting out, or if it's given to them directly, I mean, that would be up to the body to decide. But because they have that home or that facility already built by the Gura CDBG, they just need money for programming.
Which home?
The Guma Famalawan.
Okay, that's for the women. Yeah. So
Yeah.
what about for the men? You're saying would that clear up more space for them to put men into the current facility?
No, the cottage homes, I would say, is where we would expand and increase the contracts that we currently have for example, currently Lighthouse Recovery Center.
All right.
Yeah.
Okay. So how many would you say are on the men's waiting list? 10. Okay. All right. All right. Again, to all of you who are working in this field, thank you very much, and thank you for your continued work. And I know, there's a lot of changes that keep happening in these programs as well, and with our community. So you've had to flex with that, and thank you for being dedicated and for the work that you're doing. And I am very happy for you to be appointed to be the director. I agree with Senator Taitagui about this consistency moving forward. So I'm looking forward to that. And I know that's what our community is looking for, is just services. How can we get these as fast as possible? And but I want to commend you, by the way, and on your social media. For me, that's been very effective. I've been able to see it, keep that up, and also even on the radios, I hear the ads. So maybe you could do one plug for the 988. What can I get by calling 988? Like, how serious can it be,
Sure.
or how? Yeah.
It can be as serious as an active suicide, meaning you call, whether you're calling for a loved one who is in the middle of an active suicide, our staff are trained to connect you to the 911 service. And it can be as, I don't want to negate a person's feelings, but it could be as little as, I'm stressed out today and I just really need somebody to talk to. Right, so, I'm sorry? We're all gonna
call you.
Call us.
Probably 15.
But I-
24 hours a day. And there's also, another plug is there's a number that you can press to connect you to veteran,
Okay.
like a veteran line.
Wonderful.
Yeah.
And I've had asked people to call based on like their, I'm not the professional, so I always, that's great for us who are getting calls, but yeah, we can refer to professionals for even domestic violence.
Can I say that there's really no wrong, so our staff are also trained to kind of, if it's not appropriate, we give you the resource quickly and get you off the line so that we're not holding it up for somebody who's really in a crisis. So it's almost a no wrong door.
Great. No wrong door, 988.
98.
And the
I'm not gonna
mobile,
put that
and the
on the
mobile
ad,
crisis
but-
center,
Yeah.
the mobile crisis response team rather, is still
Yes.
good,
So
working,
right now we're
or?
expanding to children, but we're
Okay.
doing a soft launch, which is really only for the Guam Behavioral Health active clients, because we're hiring and training, and so once all
For
of
children?
yeah,
Okay.
we're expanding.
Because the adult one is already working, right?
It was on pause after the funding for that ended, but we have secured other
Okay.
funding sources, and so now it's going to be for all ages, but we are soft launching only for active clients, and then you'll hear publicly when this is available to the rest of the island.
Okay, so this is supposed to affect those where instead of calling GPD, or if they call GPD, GPD knows to call this mobile response team. I guess for your active clients, that's how they're going to know. And another way to help people versus direct police confrontation. All right, Situs Masi again. This hearing is adjourned. It is, can't see that, 3:20, is that correct? 3:23, yeah, p.m. Situs Masi Tatlit for all of you.